Suicide is the second leading cause of death globally among 15 to 29-year-olds and the 10th leading cause of death in Missouri and Arkansas. Suicide is a challenging topic for many people to talk about, leaving many feeling scared or stuck with questions like, what do I do? What do I say? Where do I go for resources? It can take just one person to save a life. So in fall 2020, Burrell announced the ONE initiative, which stands for Our Networks Engaged. Burrell is partnering with businesses and individuals to take a pledge to commit to suicide prevention and spreading awareness. Burrell will provide training and support to help those who take the pledge understand the role they can play in preventing suicide at work, at home, and in our communities. Businesses will pledge to implement a suicide prevention project with their employees or for the community, and individuals will pledge to take specific steps to develop and spread awareness in our communities.
Suicide is very prevalent. Not only is it for the individuals that are coming through the doors to seek services, but I find that for our families, our friends, our colleagues, it is so important to be able to have these conversations. It's something that can be taught to anybody. It doesn't have to be someone in the mental health field. It can be anybody in the community can take this training, and there's also cultural considerations that can be incorporated depending on the needs of the audience. Q is for question. That is where we are asking the question about suicide. I like to think of it more as a conversation. We are having the conversation about suicide and what's going on in someone's life. P is for persuade. That is where we're persuading them to open up, talk to us, trust us. And then the R is for refer, and that is a big piece because that is a lot of folks, and myself included, it's really scary to ask someone about suicide if you don't know what to do if they say yes. So the refer is where we have the resources and all the information to equip someone to be able to walk someone through that process if they indeed are experiencing suicidal ideation.
We want to share with that person that it's okay, like we're here for you. So that's what has pushed me to become a QPR trainer. Have an open heart and be there for that person or group or community. We're all in this together, so if we can save a life together, why not?
As more and more allies take the pledge, more and more resources will be aggregated and our network will really gain momentum. Suicide prevention can feel daunting, but you don't have to do it alone. Join us in taking the ONE Initiative pledge to join a community movement to save lives.